begin, we have a few bits of advice and guidance to give as it relates to plans for the school year in Kansas City, Missouri. Our regulatory authority does not come from an opportunity or an ability to regulate schools themselves. And so importantly, we are not talking about schools being open or closed. Whether virtual or in classroom instruction, schools will be open as directed by school districts. We are talking today about school buildings in Kansas City, Missouri. I first note that the reason we're here today relates to a number of things that have been troubling in trends relating to COVID-19. In the last week in Kansas City, Missouri saw its highest number of new infections. Kansas City saw its highest number of deaths, and Kansas City has seen an increase in hospitalizations. Those things give us grave concern about our ability to contain the spread with schools being open in any type of normal structure and way. That being said, we also recognize, however, that schools are vital to our society, to how we function, to how children are taken care of and educated. We have no interest in seeing schools delayed significantly. We have no interest in seeing educational opportunities for our children limited. And so with that, we make the following announcements. First, I will note that we'll have a series of recommendations from Kansas City, not mandates. Those recommendations will include the following. In alignment with our peers in the state of Kansas, we're recommending that schools start after Labor Day, no earlier than Tuesday, September 8th. Because that is a recommendation rather than a mandate, we'll leave it to school leadership in our public schools, charter schools, parochial schools, all schools with buildings in Kansas City, Missouri, to do what's best for them and their students, but we would make that recommendation. Our second recommendation is as schools are organizing both their classrooms and their facilities, they recognize that the rate of infection, the risk of infection, increases by age. So that where social distancing is available for things like seniors and juniors in high school, it's better for us to make sure we're using either better social distancing, virtual classroom environments, et cetera. Whereas with younger children, the risk of infection has been found to be lower. And so in those situations, we think a return to regular classroom instruction, or at least as regular as it can be, is something that we can see sooner. I'll also note that we are asking all of our county partners, that would be Platte County, Jackson County, Cass County, and fortunately our friends in Clay County have already provided funding. We're asking our county partners to provide further funding to schools to help facilitate their reopening. In Clay County, for example, millions of dollars have been given to our school districts there, Liberty, North Kansas City, Smithville, among others, to help facilitate the reopening of classrooms, to help ensure that both faculty, staff, and students will be safe upon their return. Kansas City resident children in our other school districts in Cass, Jackson, and Platte County deserve the same opportunities, and they've been asking for support. I asked my county partners to make sure they're helping us with that along the way. We'll say this for you as well. There is no broad plan for us to close school buildings if we can avoid it. What that means is that to the extent we see outbreaks, we would look to identify them as to individuals, as to individual classrooms, and as to individual school buildings. We have no intention, if we can avoid it, to more broadly close all schools in Kansas City, Missouri, as we saw last spring. However, we will note that we are always measuring new infections, hospitalizations, and deaths as a measurement for what it is that is necessary for us going forward. A few other items, and then I'll get out of the way for Dr. Archer. One relates to the fact that youth tournaments and youth sports tournaments have been a topic of much discussion of late. While we understand that everyone needs to go outside, and indeed organized activities are not something that we say are bad in any way, large youth tournaments that have brought together hundreds of competitors have been seen in other parts of Missouri, particularly in St. Louis County, to have spread COVID-19 fairly significantly. And so we're asking those who organize youth tournaments and other larger combination youth activities to hold off from scheduling those until at least after our school start date, or to have smaller interscholastic or inter-team competitions over time. We'll also note that for schools that are interested in in-person instruction, there still is a strong preference for outdoor events, recreation, instruction, rather than indoor spaces being used. As you know, Kansas City's orders relating both to masks and other activities relate to indoor public accommodations. We will continue to note that there is a distinct balance between what we're seeing indoors versus the outdoors. And so even where there are still youth sports practicing, for example, let's say there's a cross-country team that is practicing already, we would encourage those coaches not to have indoor activities on a rainy morning, perhaps like this one, or for crowded facilities like showers and other facilities to be used prior to the start of the school day. We appreciate our relationship with all of our school partners, and that's why we're sharing this information at this time broadly with all of them. This isn't just an issue where we're speaking to one school district or just public schools. We understand that parochial, private schools, charter schools, and public schools are an important part of our educational network in Kansas City. We understand that the health of teachers and our faculty and staff are vital for Kansas City as well. And it is in connection with all of those, including the health of children, faculty, parents, spouses, and so many others, that we make those recommendations today. I'll be followed by Dr. Rex Archer, and then I'll come back for more questions.
Thank you, Mayor. So some of you may remember back in the spring where my concern was that the benefits of education were outweighing the risk of the disease spreading in kids in schools. And so I actually was not supporting closing schools at that time. We closed and did the stay-at-home orders about a week before we saw the first cases here in Kansas City. That overall stay-at-home closure made a huge difference in our first wave. Unfortunately, we still had 16 deaths, but as you can see in our second wave, we are now almost at twice that, and that's continuing to grow. Over the last 10 days of this month versus the first 10 days of this month, we've seen a substantial increase in folks under 19 having this disease. And that's the big concern. We're seeing huge spikes now in the St. Louis area, and we have often followed St. Louis with this disease and this outbreak. So because of that, every school district needs to assume that they've got virtual capacity to handle education for the kids for this fall, because the chances that individuals, parts of classrooms, entire classrooms, or even potentially an entire building might have to be home because of the outbreak. We also are worried about the transmission of the virus to the faculty, the adults, the teachers, the support staff that are in those schools. At this point in time, the one piece of hope that we have, or really two pieces of hope. One, the wearing of the masks is catching on. More and more people are complying with that. And we're hoping that that will slow down the rate of the increase of this disease. The other is that we're seeing most of our transmission to kids coming from adults, family members, not kid-to-kid spread or kid-to-adult spread. So that's part of why we believe that particularly for the younger grade levels, we're much more likely to be successful at keeping them in classroom instruction and protecting everybody than we may have for the high schools. So part of this issue of delaying some of this opening until after Labor Day will give us a better sense on where is the outbreak going. Is it slowing down? Is it actually dropping back again? Or is it continuing to increase at the rate that we've been seeing, because we've seen substantial increase in the last 10 days from the first 10 days.
The only thing I have to add this morning is, as a mother, this is something that's near and dear to my heart. We were talking about our children and masks and going to school, so I appreciate the leadership from the mayor and Dr. Archer this morning on such a tough topic.
So any questions?
I have a couple questions for you, Mayor.
Who
First
speaks?
question I have is, what happens if a teacher or student is positive? How will that be handled?
If a student or teacher tests positive, how will that be handled?
If a student or teacher tests positive, at present, if a student tests positive, I think the protocol would actually be essential for the school district to promulgate. I know the Department of Public Health would certainly ask to be notified, would ask to then have, I imagine, the student go through the usual protocols as relates to being quarantined, for us to conduct adequate contact tracing thereafter, and then hopefully we'd be able to contain from there. Indeed, that's kind of, and what we've talked about for some time, the importance of contact tracing in connection with these issues, which is that to identify, right, to test, to be able to test everybody who may have been exposed, to then be able to address those concerns, or to allow people to go back to school after they've been found negative in that situation.
In regards to what you just mentioned about contact tracing, how many contact tracers do you have right now? And secondly, what's the policy about masking to be on the school buses?
So partly following up on the first question, anybody that tests positive has to be isolated. We then have to do an investigation to determine who else has likely been exposed that then needs to be quarantined. In many cases, we may have ill children, and we have children that have illness all the time. There are a lot of children at any day, at any point in a school year, that will have at least one of the COVID symptoms. So we've been working with Children's Mercy to create a flow chart and a matrix to where if a child has 2 or more of the types of symptoms of COVID, then we would be quarantining that individual because we don't know that they have COVID, and try to get them tested and then determine what does the look of spread occur right now. Now, originally we had only 3 staff that we could do contact tracing with. We've added a group of 4. We have a couple of federal assignees, in a sense, through the CDC Foundation that are working with us now. A couple people from the State Health Department. We've been interviewing over 50 different individuals to be bringing on board. Have gone through the first round of interviews and are hoping to get close to offering positions for those folks. So that's the other timing issue here, is that if we have huge outbreaks in schools, we've got to have the staff to manage those outbreaks so that we don't have to overreact. That's a good question.
And then the mask on the bus, what was your policy?
Oh, so wearing masks is required for all these different kinds of settings and will be required on the buses from our perspective. The issue of how the seating is going to occur, we're working with the school districts about trying to make sure that there's really assigned seating, as an example, on the bus. You know, 2 kids from the same household could sit next to each other because they're already in the same household. But we need to know if there is an outbreak and a positive case on a bus, who else has to be quarantined versus the whole bus having to be quarantined. So all those things, we're meeting with the superintendents and the schools to try to figure out the safest way. Little tricks of the trade. For those of you that have glasses and wear a mask, sometimes your glasses fog over, and there are tricks even with like shaving cream where you can do some things to keep your glasses from fogging over, because obviously we don't want a bus driver to have a mask on and have their glasses fog over and not be able to see. So we're working through huge numbers of details all the time now.
All right.
I have a question, Mayor. Was this a decision?
And I'm going to have a, sorry.
Was this a decision that was made in conjunction with the school, or was it purely made based on data and the information and health information that you're seeing in terms of the increasing cases?
Yep.
I hope that the plans that they've already drawn up to determine whether they would provide safe going to school, or was this just made purely by data?
This plan made with school districts and superintendents, or just based on data, or did you base it off of school district plans?
So in terms, I take the question to be, and you'll correct me if I'm wrong, was this based off of, I guess, health advice versus our conversations with superintendents and any others involved? I myself last had a conversation with superintendents on this topic. I think it's been some weeks ago. I know the Director of Health has been in contact with them more recently. I think both as recently as last Friday and then I believe last Tuesday. And I imagine there has been communication between our health department and schools, superintendents, heads of school at other types of schools throughout the summer months. What I would say is I think this is largely based off of the best medical information and advice that we have now. This is consistent with advice that I know I've received from Dr. Archer and other health directors in our region. And I know they have met regularly to talk about not just school reopening issues, business reopening issues, et cetera. So I think to answer the question probably in the clearest way, this is more medical advice and information. Medical advice and information as based on what we're hearing from health professionals, both in the Kansas City metropolitan area, our peers from the St. Louis side of the state, and advice relating there too.
Is
Yes?
there any mechanism at all to close buildings down regardless if it's a school, I mean, if it is a school, if infections get to a certain threshold? And what would that
Do you have the capability to close down school buildings?
So it's our view that yes, we do. And indeed, so the question relates to ability to close down school buildings. It would be the governor's authority or certainly a school board's authority to close down schools. And so that's why we never note any of our authority in connection with closing schools down. They can continue to exist virtually, exist in whatever way they would like. Our ability through local government regulation is exclusively with buildings. Just through the nature of things, there happen to be quite a few school districts that have buildings in Kansas City, Missouri. There happen to be a lot of schools that are impacted, both the Diocese of Kansas City, St. Joseph, other parochial schools, private schools, and charter schools. And so that's why we usually like to talk to as broad as groups as we possibly can in connection with school decisions. But that is part of the reason, frankly, why you are hearing a recommendation today instead of a mandate. If there were a mandate closing down buildings in every school district that touches Kansas City, we understand that impact would reverberate far beyond Kansas City, particularly relating to the school districts impacted. I understand that there will be individual choices that are made in places like Platte City, Belton, Lee Summit, Raytown, that while those school districts may not be headquartered in Kansas City, they certainly have a number of students that are Kansas City residents and school buildings in Kansas City, and that's why we thought it important to share what our best medical advice is at this time. We also think that when we were looking at our next step, having some consensus regionally, to the extent you can get it, is helpful for us. We're very cognizant of Governor Kelly's order in Kansas. Frankly, I support it. And so we thought as we are looking at outbreaks, particularly some of our peers across the state line, I know Wyandotte County has a high infection rate. We wanted to make sure that we were doing our part to maintain the spread and have as regional approach as possible to how we address the school reopening question. John?
Mr. Mayor, what would you advise a parent to do who may face the difficult choice of having to work to keep their job or caring for their child because of a delayed reopening or classroom shutdown?
So I think first things first, I would recognize, and I think we all recognize how challenging this moment is, particularly for parents who are working or have to worry about any number of obligations. Let me break it down by ages. We are not changing our policies and approaches to daycares and daycare facilities in Kansas City. In our current order, daycares can remain open. We have recommendations as to the size of students to be inside a daycare facility at a given time, but that will continue to exist. As you get older, our health department has promulgated previously advice that relates to some support for opening of primary school or younger elementary school classrooms for a number of reasons relating to the development of children, the education of children, the fact that they seem to be at less risk of infection at this time, and thus less risk of spread. And, I think candidly, in many ways they cannot be watched, or they have to be watched in a way that's different than a 16-year-old child or a 15-year-old. As you go older, we think that hopefully some of the age breakdowns will address our child care question. And so you may see more virtual, and I'm not a superintendent or a school head, and I don't pretend to substitute their judgment. I think our best advice may be that if there are virtual options for high school, for example, you may wish to proceed with a robust program in the secondary school level. And so going from there to try to in some ways mitigate the issues relating to school, parents and certain schooling issues. We would also ask Kansas City businesses and Kansas City employers that I think have been very kind to their employees for the most part throughout this pandemic to continue for several extra weeks to help address these very important concerns for families in our city. We, in our last order that I promulgated, we already have encouraged employers to continue to allow greater Family Medical Leave Act rights. We continue to encourage employers to allow parents who have to care for children to be in the home where necessary, and so we'll continue to make that request now. Many of us are probably, or many of us of a certain age, or will remember when schools actually did start closer to the Labor Day date, and so we do not think that this delay is something that will necessarily create a long-term negative impact on the educational year. I'll continue to reach out to my friends in Jefferson City, including Governor Parsons' office and our Department of Elementary and Secondary Education, to make sure that schools aren't punished if they choose to take the election to start later in classroom instruction. But this is still continuing to be the best medical advice we have. And here's the balance. I have talked to a number of teachers in particular who are concerned about returning to the classroom too early, and teachers that are concerned about returning to the classroom when there is not adequate protective equipment, when there may not be adequate plans to maintain their safety as well. Teachers and staff have families themselves. They have families sometimes at risk, and it's also our duty to make sure that they can stay safe. I think this is a step that allows us to do so.
And Mayor, yesterday you joined other mayors across the nation in signing a letter opposing Homeland Security agents in local communities to quell protests. How would you draw a distinction between opposing that and yet rolling out the red carpet for 225 federal agents in Kansas City to combat other violent crime?
Well, I would disagree with your premise, and I think I would say we have an opportunity to discuss that at a later time. I'm going to stay focused on schools for today. Any other questions?
Yes. Are you worried for the future of Kansas City schools just on the rate of the data that we're having right now? Are you just worried about the future of reopening schools?
Am I worried about reopening schools? Yes. I mean, I'm human. I would think that, so the question relates to reopening schools. I'm worried, I know Dr. Archer's worried and Dr. Carney is worried on every part of it. And I'll just make this clear to people because I think there's confusion sometimes. We don't wake up in the morning with conspiracies to do things in one way or the other. We have grave concerns with not being able to have children in the classroom as soon as they can be. I frankly continue to have grave concerns of the fact that I know that there were more than a few schools and more than a few children that had trouble getting as strong an education as they could have last spring after our orders shuttered school buildings in Kansas City, Missouri. And so this is something that I know all of us here worry about consistently, worry about a lot. But I think what I just said relating to the safety of our community is the important balance for us. This is why I actually said, when I mentioned money from the counties, it's not because, it's not me asking for money today. It's making sure that teachers in Raytown Public Schools, Lee Summit Public Schools, Raymore Peculiar, Platte County R3 can actually get PPE, so schools can get millions of dollars of support that they need to actually do things like you see here in City Hall, where we have protective shields, where we have extra masks for anyone who comes into the building. we are trying our best to handle what is a very difficult situation, I think, for our city, our community, and our country. And so, no, I'm not leaving this press conference thinking, boy, we've taken care of it, because I absolutely do worry about the fact that there's going to be a 6-year-old in Kansas City, Missouri, whose parent may continue to go to school. And if that 6-year-old is not in a classroom, what might that mean for their educational opportunity? That pains me greatly. And I know all of our superintendents, our principals, and our teachers are worried about that as well. That's why we're giving this much notice, and that's why I think we're trying to address this as best as possible. This is not an order closing schools in, I guess, in-person classroom instruction for the entire fall semester. There have been some who have asked for that. We are not there. Instead, I think this is successfully, hopefully, buying us time to make sure we're ready to address all the issues we'll need, particularly as we get to the cold weather months when we might see further spread. With that, go right ahead.
I know that some of the districts and some of the schools already have plans for reopening, plans that they believe are safe for their students and their teachers. A scenario in which you may need to issue a mandate, meaning some of these districts and some of the schools do not heed the recommendation you're making today.
The question relates to, will there be certain situations in which we'll see the need to issue a mandate? I think throughout the COVID-19 crisis, we have seen a necessity for mandates, particularly as it has related to businesses and business and commercial activities in Kansas City. At this point, we are not feeling the need to issue that mandate, the reason being because almost every school district, I think, has acted responsibly throughout this crisis. I think when you're looking at the incentives that encourage them to act, it's slightly different than what you might see from private enterprise. I think no school district wants to see an outbreak inside any of its school buildings, in the same way that school districts are pretty tough on making sure no one can register if they don't have their immunizations. You see the exact same thing here. And so we've seen our school district and other school leaders as partners throughout this process. We will continue to see them as partners throughout this process. And I think there will be a certain reality, which is this, for better or worse. Some schools will procure adequate protective equipment. Some schools will come up with alternative plans, perhaps at a rate that is in some level different from the speed of others. To the extent that schools and school buildings are ready to do so or to open at a certain rate, then I don't know if it's my way to stand in the way. I'll use an example even within one school district. Let's say if at, name your school district, Kansas City Public Schools, they are more prepared at Central High School to handle social distancing, mask wearing requirements and all of that than they are at Southeast High School. I don't know if the district would look to do something different, but if that's the prerogative of the school district itself, then we don't think it's our role to stand in the way, particularly if in both situations they're following good public health advice and guidance. It's for that reason that we are making it a recommendation today rather than a mandate, and we believe that school districts and school leadership throughout all our types of schools will continue to be good partners that are concerned about the safety and well-being of their students and their families. Yes, sir. Or nothing for you? Okay. All right. With that, thank you all so very much.
I'm sorry, Mr. Mayor, one last thing regarding to your COVID test yesterday. You got results back pretty fast.
I did.
Faster than most people do. How could that be? And should you be quarantining anyway for out of abundance of caution?
Right, so I got a test in the late morning, early afternoon hours, received results back probably 4 or 5 hours later. And so 2 different tests were taken, and so that was an initial negative test that related back to it. It's not the advice that I've received that I need to be under any level of quarantine, and so that, I think, addresses it.
But a lot of people are waiting a lot longer for COVID test results. How do they get that test how can they avail themselves of getting faster results than what they're...
I continue to, I've gotten all the tests that I've received so far, which have been several, through the Kansas City Health Department. Sign up goes through the health department. You can call 311 in Kansas City for that. And then I've heard different kind of numbers on how rapid test results are. I did have a conversation with the health director this morning, however, that we continue to need further federal government support, I think, to enhance our ability to have testing supply, have testing availability, because I think we are missing some necessary ingredients where long-term we may have longer test results coming in, which will mean that more people are removed from classrooms or businesses or structures for a longer period of time. So frankly, when we talk about some of the money that's important and some of the initiatives that are being discussed in Washington right now, this is why we'll need further funding to make sure that folks can avail themselves of testing in a more rapid way so that you can get back to work or any number of other life's necessities. Thank you all so much.